associated, and I forgot that, we're going to be recording the meeting, so I hope it's okay with everybody. This is the first of several workshops that Liz and I are organizing, and they are associated with the Curriculum Enhancement through Global Learning program. So the structure today will be that I will start with a few words about global learning, and then Liz is going to take over and introduce our panelists. Our panelists then will present, and there will be a chance for FAQs at the very end. So if you have questions as you are listening to what our panelists have to say, if you don't mind putting them in the chat, and then there'll be a moment at the end where we can all talk. We're also going to drop a number of links in the chat all together as, you know, one big blast, so that we're not distracting you throughout. I'd like to start by introducing the Curriculum Enhancement through Global Learning program. This program guides faculty towards integrating global learning into the curricular and co-curricular activities in the Curriculum Enhancement through Global Learning program. This cohort, is the third year. So the program started in 2018-19, and approximately 1,000 new students are impacted annually. Several faculty across many disciplines and schools, and including faculty from NPB and epidemiology, vet med, UC Davis emergency medicine, and several other schools and other programs have participated. I was very lucky to participate last year as a writing program lecturer. Because we do recognize that different disciplines and pathways demand diverse solutions and possibilities for integrating global learning, we are doing diverse workshops throughout. So you'll be hearing about the few workshops we have signed up. The Curriculum Enhancement through Global Learning is led by a renowned expert in the field, Hilary Landorf, who's the Executive Director in the Office of Global Learning Initiatives and Associate Professor in International and Intercultural Education at Florida International University. I'm gonna put a plug in for the cohort of spring. The program is enrolling right now. If you're interested, you can sign up. Liz has dropped in the chat the link, but you can always talk to us, or you can go to the Global Affairs website and look at the information there. So why global learning? Next slide. So this is a world where global challenges, networks, and dynamics profoundly shape our lives. So we need scholars, entrepreneurs, educators, artists, employees who are ready to navigate across very different cultures and political and regulatory environments. And we also need, and I cannot stress this enough these days, empathetic leaders, curious leaders, caregivers, community members who understand issues in cross-cultural contexts and who can collaborate to resolve them equitably. The integration of global learning into curricular and co-curricular activity supports UC Davis students in developing the skills, the knowledge, the network, and the attitudes that will help them thrive in this role and in this world. To achieve global learning at UC Davis, Global Education for All, an initiative which is championed by Global Affairs, is committed to educating the next generation of problem solvers and change makers. With this initiative, UC Davis is working towards providing every single 100% of our undergraduates, graduates, and professional students with global learning opportunities that hopefully will change our lives and our world. And I mean this from my heart, because we need it. The next slide, and then I wanted to share the global learning goals. These are 3 very broad learning goals that were crafted by the Global Education for All Steering Committee, which is made up of faculty, staff, and students from across the UC Davis campus. The global learning goals support integration of global learning into the broad curricular and co-curricular activities at UC Davis. And these 3 global learnings, which are global awareness, global diversity, and global action, as you can see in the screen, there are resources to guide development of courses and programs that integrate global learning. Each goal, if you go onto our website and you click on the goals, you'll see that if you click on each goal, there's a drop-down menu of the global learning outcomes. And these reflect capabilities that are broadly relevant across disciplines and fields. So we encourage further adaptation and addition to reflect specific subject areas. Activities are towards these goals are divided broadly into 3 pathways: academics, experiential, and living and leading. And one last thing, and then I'm going to turn it over to Liz, is as you all know, 2020, we faced a lot of challenges, and one of them was the pandemic. So in order to respond to faculty and students about how to strengthen global and international collaborations in the face of the pandemic that hit last year, we developed a page, Global Teaching and Learning Resources for faculty. And if you look at it, we have a number of resources there to help faculty connect with and students with others around the world and support their students in a very difficult time. So if you visit Global Teaching and Learning Resources, you're going to see that there is a lot of information about virtual exchanges, Sustainable Development Goals Library, a collaboration we did with the UC Davis Library, where the Shields librarians developed a subject guide for global learning. So there's a wealth of information. We encourage you to take advantage. So too much from me, but the most important part is now to turn it over to Liz and to our wonderful panelists.
So we're really excited today to have representatives from the School of Medicine, the School of Veterinary Medicine, and the Betty Irene Moore School of Nursing with us to talk about how each of their schools, in their experience and more broadly, tries to integrate global learning into the experiences that their students have. I'm going to introduce them in the order in which we're going to have them speak. I'm doing it alphabetically. We're going to start with Dr. Shakira Bandolin, who is an emergency medicine physician and is acting as the Director of Global Health for the Department of Emergency Medicine. Her focus in this position is on developing emergency medicine education and infrastructure around the world, in addition to practicing clinically at the UC Davis Medical Center. Shakira has a special interest and formal training in international emergency medicine and the development of emergency medicine and education globally. Our second speaker will be Dr. Pat Conrad from the School of Veterinary Medicine, who is the Associate Dean and Professor of Pathology, a professor in the Department of Pathology, Microbiology, and Immunology. Pat is Associate Dean in a school that is consistently ranked as one of the top veterinary schools in the world and has been so for many, many years. I remember when I was a high school student in California, already that was where people wanted to go to study veterinary medicine. She is also the co-director of the University of California's system-wide UC Global Health Institute. Pat is a veterinarian and a distinguished professor of parasitology. Her research is focused on the transmission of protozoal parasites between wildlife, humans, and domestic animals. She joined the faculty of the UC Davis School of Veterinary Medicine soon after she conducted postdoctoral research on the molecular epidemiology of tick-transmitted diseases at the International Laboratory for Research on Animal Diseases in Nairobi, Kenya. And our final panelist will be Professor Laura Van Auker, who is an assistant clinical professor for the Master of Science Nurse Practitioner degree program and for the Master of Health Sciences Physician Assistant Studies degree program at the Betty Irene Moore School of Nursing at UC Davis. She brings an expertise in healthcare policy, promoting use of advanced practice registered nurses to improve community health and access, particularly for underserved, diverse, and rural communities. Her program development and clinical practice extends into global health with work in both Mexico and Kenya. So we have a very diverse panel who has experience globally. So I'm looking forward to hearing what they are going to share with us today. And we are going to begin with Dr. Bandolin. So I have stopped sharing my screen. Shakira, the stage is yours.
Thank you, Liz. Hi, everybody. Nice to meet you all. Thank you so much for taking the time to join us this afternoon. So what I thought I would do is, because this is a pretty broad topic. So I am from the Department of Emergency Medicine. And so instead of showing a PowerPoint, which I actually created one and then realized that it was very difficult for me to stay within a reasonable amount of time. So I thought maybe it would be better just to talk, and then we could focus on questions and we can share links and all that afterwards. So I am from the Department of Emergency Medicine. And so briefly, when we discuss the School of Medicine, I wanted to provide a really broad overview, because in my mind, this includes focused training for medical students, residency training, and then also for fellowship training, which of course encompasses a huge range of students and trainees. And my focus mostly today will be on the residency part and the fellowship training, partly because the medical school program is incredibly robust. And one of our colleagues, Dr. Michael Wilkes, really focuses a lot of his efforts on this and has done a wonderful job building his programs. And we can include some links to that afterwards. But I thought, just for the sake of time, I know a little bit more about the residency and fellowship aspects of it, and we'll try to talk mostly on that. And so in discussions around how do we create and incorporate global learning, I thought it might be useful to do a brief background about what we do. So for our residency programs, as many of you can imagine, clinical education is really focused, is really intense. And for most of our trainees in residency, they're really interested in sort of aspects of global health. And in my mind, that also includes taking care of vulnerable populations, but clearly don't have a lot of time. And so as part of our training programs, we have really prioritized global education in a few different ways. So first of all, we really incorporate discussions around how emergency medicine is practiced around the world in different environments, and also how to care for vulnerable populations or people in low resource settings. That's actually integrated now into our basic curriculum through a variety of ways. We have conferences that we do weekly, and we try to focus efforts on that. We talk a lot about this in journal clubs and have really focused our efforts on equity, which have ultimately led to discussions around this, because we have found many wonderful examples around the world. Additionally, we have actually a certificate program. It's called an Area of Distinction in Global Health within our residency program. And so as part of that, residents participate in a whole curriculum that currently is all online, where they do case training and then get some broad education in what it means to practice in other settings and what does global health mean. And then we actually do monthly sessions, which are now all remotely over Zoom, where we invite speakers from around the world to talk about different aspects. We invite trainees from other programs in other countries to discuss what their experience is like internationally. And my hope is eventually we'll be able to progress and actually do exchange programs with some of our partners overseas. And so for many of our residents, they now actually have time that's dedicated to working in some sort of project that's considered an international or global project. Previously, we actually had a month-long block that our residents could leave, and then they could go to any of our partner sites around the world and work and train. Clearly, with the current pandemic, we have pivoted, but I think it's actually brought out a lot of really wonderful opportunities. And so now we actually have created what we call like a global local rotation, where our residents actually can do rotations and get clinical experience with some of our patients who are dealing with HIV, TB, other infectious diseases, and also focus more on some of our vulnerable populations domestically. For example, we now have a partnership with the Indian Health Service, and specifically one of our trainees is working with the Apache Reservation in White River, Arizona to help coordinate their COVID response and also learn a lot from them. So outside of the residency experience, and like I said, we'll be pretty brief about this, we also have a new fellowship in global emergency medicine. And just for some background, global emergency medicine is a really, really broad term, just like global health for anything else, but encompasses a whole bunch of aspects of clinical care, education, and research, including disaster response, clinical emergency medicine practice overseas. And also, because emergency medicine is a relatively new specialty around the world, we also focus on helping our partners in different environments build up their emergency response services and also their emergency training programs. And that's really kind of what I'm most passionate about and what my focus is. So just to provide a brief example, right now we have helped with some of our colleagues in South Vietnam create the first training certificate program in emergency medicine. They don't quite have the ability right now to do a full 3 to 4 year training program, but they are now doing an 18-month training program. We intended to start this before the pandemic and have been fortunate enough to have wonderful partners and colleagues who have allowed us to pivot. And so before we were actually had fellows and trainees, and we were going to do exchange programs back and forth to help move this program and provide bedside clinical teaching. But given our current situation, we now do weekly training programs where we provide online education and resources back and forth actually between our trainees and theirs. And then we provide focus training once a week in sessions. We also have real-time like WhatsApp groups and chat sessions where we can review clinical cases and ultimately hope to create a system where we can actually review ultrasound images and other clinical cases real time in a safe de-identified manner. So a lot of things going on. And so I'd say, just to briefly summarize, I think our goal is to figure out any way we can to sort of continue to incorporate global education. And for me, that is also us learning just as much from our colleagues as we are delivering information to them. And I could talk for so long about this, so I will go ahead and pause for the sake of time and just say that we will provide more information, and I'd be happy to answer questions about this more focused after the session as well.
Thank you very much. I couldn't stop taking notes myself.
I know. Same
So
here. Thank you.
I want to pass.
So fast, Liz. I could have talked for so long about what else we had, but I didn't want to go too crazy.
So I am going to encourage people, if you start thinking of questions that you'd like to ask the panelists, please do drop them in the chat as well as hang on to them, and we will both call on you and we'll be gathering questions from the chat. And I am going to turn to our next presenter, and we'll go through all 3 presenters and then sort of open it up for the larger chat. So Pat, over to you.
Thank you so much. And I will also try to be concise, stay in my 10 minutes, but I'm a visual person, so I have to have pictures, all right, to go with everything. So I want to make sure, just a second. I think I pulled up the wrong thing, just a second. I pulled up my website instead of pulling up my, this is what we need to pull up, the presentation, because here we go. So this is focused just on the veterinary students, a little bit of the graduate students that are affiliated with the School of Veterinary Medicine. But I'm going to try to just focus on, because this is a very short period of time, what is being done in our Office for Global Programs within the School of Veterinary Medicine. And at the end, I'll send you the link to get to our website. You can get through the research portal, but I'll also give you the direct link. And just to introduce my incredible team, Dr. Paulina Crook is the director of our global programs, and she's on maternity leave now till the beginning of March, but she's very much engaged with global affairs and also with our students. And Carolyn Forley, who's our administrative assistant, who is invaluable to us. So this Office for Global Programs was just set up about 6 years ago. There's other things being integrated into the curriculum, but I just want to talk about the things that our office is doing with our veterinary students. If you go to the website, you'll see we have 3 main focuses, and international travel, helping people, all faculty, staff, and students, but then a special emphasis on our students. And before I move off of this page, I just wanted to highlight our close affiliation with global affairs and this link to the cultural awareness workshop and video that we did with global affairs. So how do we help our students to get global experience? We've been fortunate to be able to build our programs. We have 3 funded programs: international summer externships, our global fellowships, which based on the funding that we've been able to obtain are focused on feline health or working with underserved communities. And then most recently, a internship opportunity that's been set up in collaboration with the Cheetah Conservation Fund. So those all come through my office. They offer funding of between $2,500 maximum for the externships, up to $6,000 for these global feline fellowships and underserved community fellowships. And that's matched with what we make available through our STAR program, which is a research program that we do with the Office for Research in the School of Veterinary Medicine, but they've been very supportive of these research projects being global. So I work with all of the students that have an interest in having a professional experience outside of the United States during either the summers. They only have 2 summers, our veterinary students, between their 1st and 2nd year, and between their 2nd and 3rd year. And what we're trying to do is get them funding so they don't have to, they can have these experiences without going further in depth and in debt. And we work with, these are, we don't have a lot of big programs that we send groups of students. We actually work with each student individually to tailor make the kind of experience that is going to be best for their personal and professional development based on what they want, and then matching them with faculty mentors to help facilitate that. If you go to our website, this is one of the maps on there, which can show you that over, I think since 2016, where some of our students have had projects, and you can go back and check those out. This is not all of the veterinary students that have gone overseas. These are just the ones that have received funding from the Office for Global Programs. So I wanted to also highlight, if you check out the website, one of the things that we ask all of our students who receive funding to do is, when they return, write up a 1-page sort of description of what they did with photos, and also have 1 to 3 minute videos. So if you go to these sites, starting about 3 years ago, for each one of the descriptions of where our students went, and there's a longer description if you click on the link for each one, you can also watch their very, I think, amazing, they get better every year, 2 to 3 minute video about their experience. And this is just to show you some of the things. A lot of times this is an entryway, not just to the global experience, but for students to experience different types of research as well as clinical experience. And I won't talk about these, but you just get some kind of idea of the kind of projects that the students have done. Sometimes very much with the community. This was with the Asian elephant handlers and their relationship with elephants, clinical experience here with exotic animals in Australia, especially the marsupials, and here with sea turtles. So a wide range of experiences. And over the last 2 years, since we've been able to set up the fellowship and the Cheetah Conservation Fund internships, these programs have grown, and so too have our international summer externships. Now, we all know what happened in 2020. Obviously, none of the students who applied for these fellowships, which the applications went in February. By the time we were picking the applicants, we had a good idea that international travel might not be allowed. So what we did was go ahead and award, based on their proposals, what the funding for the projects. These are faculty committees that make these awards. But then I worked with each one of the students individually as the situation evolved to figure out what they were going to be able to do. We had 5 of our students that were awarded funding that we're able to modify their projects and either make them virtual, like Hannah and Sophie. Sophie's actually a graduate student. We have one program where we do fund graduate students, and they were able to progress with their research projects by doing their work virtually. But we also had other students who were able to modify and adapt what they'd proposed to go and work with on antibiotic resistance in chickens in Malawi, to working with dairy cattle in Tulare at our Veterinary Medical Research Center, or in the case of Amber, actually doing visiting locales in California and working at UC Davis in the lab of her mentor rather than going to Australia. And then we had another really unique experience of a student who was able to do both, have a virtual component and also an in-person component in California, because no one could travel internationally. We also allowed students, as part of this flexible approach, to defer their awards. In other words, to be assured that they had the funding and then defer it, either to be used this summer, we hope, or apply to their senior externships. And we won't talk much about that, but that's another opportunity for our students to get out. What about, though, and this is always the big question, and maybe in the discussion we can talk a little bit more, what about those who can't be mobile for one reason or another? We try to facilitate that, but what do we do to help them expand their global awareness and cultural awareness? Well, we have this every year Global Programs Day. This has started like about 3 years ago, that not only has an evening presentation, and you can all be invited to this if you'd like, where the students can talk about their experiences, but also we've added a noontime seminar where we talk about things like climate change, the importance of cultural awareness. We did that in 2019. And then in 2020, we started to help students see through the careers of veterinarians, how this kind of global awareness can actually change your perspective and lead you on a professional journey you may never have imagined. And also to emphasize, I know Global Affairs has done a great job with this, the importance of showing how veterinarians and people working in the veterinary field are contributing to the UN Sustainable Development Goals. And we're very big on that. And then locally too, this is a project we do with program we have with the School of Medicine, and some of you may be familiar with this. And we consider this as part of the global experience, and that is working locally with people of different cultural backgrounds, and that's happening with the Knights Landing One Health project that the medical school and the veterinary school do together. And then finally, I just want to, if I have time, just want to mention two things. The one real organized program that we've helped to support, it's actually led by the One Health Institute, is this RX One Health course, which we've had in Rwanda, and then the last couple of years in Tanzania. And last year we couldn't have it because of the pandemic just all emerging too quickly. But this year we're trying something new, and we're actually going to have this One Health RX One Health Field Institute in California. This is especially for medical students, medical graduates, nursing students, nursing graduates, all of the different health sciences and veterinary, all understanding how this One Health approach of human, animal, and environmental health as a perspective to looking at solving health challenges can be tackled locally and globally. And I just wanted to mention what we're using to help leverage support. We're going to have a new dean coming in, but I'm confident that we can keep going with our global programs, because it's actually, there are some accreditation standards that speak to the importance of global awareness and diversity, and linking those two more closely, I think will create a lot of opportunities for us. And can I mention one last thing, a little over, but this is applicable, I think, particularly the audience that we have here, and that is, if you hadn't heard of it, we send it out every year, but maybe it hasn't reached you, is that we at Davis is part of the Global Health Institute, UC Global Health Institute, and one of the great programs we have is a NIH Fogarty funded training fellowship, okay, for 1 year overseas mentored research program in global health. And I just wanted you to know, look for this. We're picking the The fellows, we had 7 applicants from Davis. We had great applicants, and that selection's being made next week. But look for this next year in November, because we'll have a new deputy director, Dr. Beatriz Martinez Lopez, from our faculty, and this is a fantastic opportunity, okay, for nursing and medical students, as well as veterinary and graduates. And that's it. I just say what I love about global learning is because I really think it helps to expand the horizons. It challenges people to think, our students, we try and challenge them to think about how they imagine their life, and that it could actually be even more exciting and globally engaged than they ever imagined. So that is me done, and I'm here to answer questions as part of the discussion too. Thank you.
So our last panelist today is Professor Laura Van Auker. So I'm going to turn the stage over to her. Laura?
Thank you. I actually am responding to the prompts that we were getting and how we integrate into our program specifically. Do you have my slides to go ahead and pop up? Okay. So we background a little bit about our program. We are probably the youngest school in the university. We are 10 years old, just had our anniversary, and we're actually the youngest postgraduate university in nursing across the United States. And in that time, we've done some really incredible activities with focus on research and support of our programs, particularly the nurse practitioner, advanced practice, a physician assistant program, both of which were rooted actually historically in the School of Medicine going back to 1975. So when we made that move to an independent college, it took some growth, and I won't say broke, but redefined some of the relationships that were a little bit different curriculum driven. And so we're in the process of building to many of the types of activities that you see in the School of Medicine and School of Veterinary Science. One of the things that is especially unique about our university at the Betty Irene Moore School is that we have a very strong international and interprofessional cohort, very high in diversity. We exceed the national norm for diverse students and cohorts, and many of those have a focus on the health sciences. Of course, we are exclusively postgraduate, and so we are unique in that type of way. And we also have accelerated programs, which creates a barrier sometimes with partnering with some of the other health sciences because of our schedules being different. So we have had a very strong engagement in local global. Some of the things you've heard from some of the other professors include, we've been very actively involved with the public health department, which housed the refugee clinic. And so we've had students in that environment for years and years and years now, very actively involved in interprofessional practice. So our clinical placements really include our students being engaged with new refugees or with underserved clients with a immigrant heritage. And also we have a faculty that is very engaged in global work, both on a research level and also as presenters at conferences. We have some strong individuals, and Professor Worley is here right now, Dr. Gerald Kaingo, who is now of the University of Maryland, and myself have been the 3 people that have really been pressing forward on this development from the School of Nursing in global affairs. The other thing is that we have all participated on our accreditation agencies are very specific about the prescribed requirements for our certificate and national boarding. And so our types of activities have to meet specific clinical needs. Our students have no extra time to participate in elective type of activities. And so what we are focusing on is how can we find those international experiences that will meet the criteria for clinical experiences as well. And that's been a little bit of a barrier, but that we're working through that. So one of the things is working on that global placements was we actually applied to the Sustainable Development Goal through Global Affairs, and we're able to actually win that grant to do a pilot project for establishing international experience in Kenya. I have 20-year experience with Kenya. plus Mexico, Professor Worley that's here does in Mexico, Norway and Scotland. Professor Dr. Kaingo was from Uganda. And we have a multitude of faculty that are engaged with those types of partnerships that up until the pandemic, we were ready to leverage. Next. So one of the things from a curriculum standpoint, we have a new added focus to that mission and vision that includes global focus. It's always been encompassed as providing services to a diverse and underserved population, but we're really making a statement about global citizenship to our mission and vision. We also have a new dean, Dean Kavanaugh, who is particularly experienced in global activity and is passionate about facilitating faculty and students to engage in that way, including overseas and experiential types of activities. And so we're on the cusp of launching the formal types of things that you see through the School of Medicine and the Veterinary School. There's that desire, even though we have these local global, which absolutely can be as rich as international experiences and can make as much of a difference. We really need to develop those templates and funding resources to do the types of things that you see in our more mature health science programs. Along that line, Global Education for All has helped us ramp up our global focus within our curriculum. An example is another grant that we actually were able to receive from Global Education for All was the food theme. And we actually did a curriculum active learning session around nutrition using cultural nutrition counseling in an immigrant population because the Hmong and the Afghan community have specific problems with anemia with our local clientele. We focused on how we do culturally sensitive nutrition counseling around anemia for the Hmong and the Afghan population and use that as a launching point for the cultural competency that it takes. Also, we talk extensively about working in low resource populations and how important that is. Next. So along those lines, kind of advice for faculty, and it really is advice for our students too. You can't walk into a global experience and think that you're going to save the world. There's a very strong commitment to this being partnerships that are important to the individuals being served. It's a team effort, and that takes work and nurturing. And it takes planning. And so I would advise that really finding those like-minded, globally experienced faculty and administrators has been really important for us. We came together informally because our school didn't want one more subcommittee. So we actually informally came together and developed a strategic plan and set goals and timelines and agreed on a local focus. So it really percolated up from our faculty with a passion. And then we also started looking at our local global resources, which included our local global, also the university level, and also within our organizations. For example, the National Organization of Nurse Practitioner Faculty has a global interest group that Professor Worley and I are very much involved in. And all of those kind of tie into the Sustainable Development Goals and diversity activities. And so it gives us permission to inject those routinely into our case-based learning. We may include an individual who's a new immigrant or of a heritage that has special focus around nutritional traditions. And so we try to integrate that into our actual activities of learning around case-based medicine. And the other thing is global affairs, I can't say enough, has been helpful in providing a stimulus to formalize and refocus our activities. Next. And so becoming a part of that bigger picture, I think, has been very important, particularly because, for example, the School of Medicine and the School of Veterinary Medicine have been strong mentorships for us. And they also help us leverage within our administrative goals and financial goals within our school about why this is important. And I think you've heard that One Health is very much what we're about. You cannot, my experience in Kenya has been, I work with the agronomist, I work with veterinary medicine, I work with the agricultural, because what they're growing in their gardens makes a difference on how they're eating and what their resources are. And so that's been important to take a look at when you're on HIV meds. What does that do to your nutritional deficits? And so when we're nurturing student interest and promoting that interest, that image of global citizenship, it has to be tied to developing skills and experience. And I think understanding how to work in low resource environments is a particular agenda that Professor Worley and I both really promote. He's a specialist in wilderness medicine. And so we inject that type of activity in working with low resource populations, which includes undocumented migrant populations within the state of California. So we inject that into our discussion in all of our, we may be talking about, management of acute MI, but we're really going to be talking about what is that patient's resources, and that develops the student's abilities. And then the other thing is we are really fortunate that we have a professor, Dr. Jan Murray Garcia, who is actually an international expert in cultural humility, which is just slightly different turn on cultural competency. She was just awarded the Citizen of the Year for the city of Davis. She's quite inspiring, and she is always making connections for us on an international level that will potentiate our involvement. And then I want to really, again, comment on how the local global is so rich in the Sacramento area and across California, and that absolutely can be as powerful as you've heard from some of the others. It's fun to go internationally, but it's not the only way to learn how to be a global clinician and healthcare provider. Next. Was there one more? I'm trying to think. No, there's not.
Nope, that was it.
Yeah. One other comment that I want to make is that both Professor Worley and I have accessed and were selected as global faculty ambassadors. And I would really encourage faculty to do that, because the ability to go, say, to an international conference and to be a global ambassador, which gives you certain responsibilities of making connections and networking, and brings the authority kind of and the prestige of the university, has been extremely beneficial. It is not hard to put in the application. It is well worth having that pride of being a global Aggie, and certainly the connections and power that were useful for us have been beneficial. And in fact, Professor Worley has had guests from other universities in Scotland actually doing remote into our classrooms as well. So greatly facilitated our ability to inject into our classrooms. Thank you.
Thank you, Laura. So 3 very rich presentations from all of our panelists, and we would like to open it up to questions, and we would be delighted to open it up to questions from you all first, if you have any, and if not,
we have some in the chat, so we could start
okay,
with the
let's
chat.
start there, please.
And then we can, since this is a nice group, we can have people unmute once we, finish up with the chat. So there was a question for Shakira from Annalise, but it was answered in the chat. Is there anything you want to add, Shakira? And then I'm going to move to Michael, who had a question as well.
Of course, I'll just be brief. So Annalise had mentioned, and just to paraphrase, kind of who can be involved in these sort of programs that I had mentioned. The answer is really, so for our residency training programs, any resident physician within any program actually can join. So we do focus on emergency medicine, but we actually do have some trainees from family medicine. And then people have showed interest from OB. And really, I think the biggest limitation is just time. But we welcome everybody and anyone who wants to join our sessions, even if you don't want to participate in the actual program. Faculty are also more than welcome. And this year in particular, with the remote learning, we've had more faculty joining from all over the place. And so as far as the medical student programs, I can't speak as much to that, but I will say that we have lots of opportunities for residents and faculty. And then medical students do participate in some of our sessions as well.
Thank you. Thank you so much. Michael, would you like to follow up with your question?
Sure, that sounds great. Well, thanks for all these amazing presentations, and it's great to see everybody. And it's, you know, even when we think we know what a lot of the things that are going on, there are always new things that pop out and emerge. So I was eagerly taking notes on everything. But, you know, part of our job, among the many things we do in global affairs, is to help facilitate partnerships. So the question that I had for Shakira after listening to you was thinking about your residents and the experiences that you're looking for them. What are some of the desirable characteristics that you're looking for in partners and sites, et cetera? Just kind of what's the ideal?
Well, that's a great question, because honestly, we've struggled with that so much. And part of the reason we've struggled, it's actually because I think we have global emergency medicine has such a broad focus, and emergency medicine in general, right, incorporates vulnerable populations. From our patients are incredibly diverse, and also the teams that we work with. So we are very much a team specialty. And so as part of that team, critical people who are part of that are nurses, we have pharmacists, and our EMS providers and pre-hospital providers. So because of that, our scope has been incredibly broad. And so we have participated in projects overseas, from helping EMS providers just get training. We helped start one of the first paramedic training programs in Bhutan, all the way to like actually delivering clinical care in emergency medicine. So it's really broad. So what I would say is, to answer your question more focused, I think the thing that we've really been focusing on now when we're looking for partners is really finding partners who we can actually provide services for, and maybe we are the most unique. So what I mean by that is that sometimes I've realized that we as individuals are incredibly useful and they want our knowledge base and we can help provide education. But sometimes what they really need actually is just funding, or they need help supporting people who can go and actually lobby their government to sort of support emergency medicine and advocate for them. And so over time, I think we have become more focused on education, because I think that's a resource that is hard to reproduce in another way. And so we have provided more and more individual education and building educational programs. But I think when considering other partners, this is a really long process where I don't think we've had any successful partnerships that have been shorter than, years, like 4 to 5 years before we really felt like we started showing a difference. And so not only do we always try to consider, how are we really the most useful people for you, or the most useful resource? Also, how can we make this project sustainable? So for example, with our other countries have come and talked to us about helping them start residency programs. Part of the reason that we haven't committed to many of those is that it takes so much to actually create one, that I think before we engage in that process, we want to make sure that the project is sustainable, and also it's incorporated in the project that we can make ourselves obsolete. So we have before we even commit to a partnership, I think we need to have an exit strategy. That's actually become one of the most key things that we use to decide whether or not we engage in a partnership. Sometimes we just do, we show up and we teach, and that's wonderful. But especially with this residency program in Vietnam, before we were willing to commit and start bringing trainees, we really emphasized to them that we don't actually want to be a part of this in 20 years as part of the core function. We really want them to be doing this without us completely. And so I think for me, there's a lot that goes into finding partnerships, but making it sustainable, making it worthwhile for everybody's time, and then also making sure that we have all the resources and infrastructure in place to make it safe and successful are probably the key aspects that I consider when looking at new partnerships. And I hope that answered your question, Michael, and was not too rambly.
Absolutely, that was great.
I was actually going to open it up to our other two panelists.
Exactly. And Laura wants to start, and maybe Pat can chime in after.
I absolutely agree. This is not about us scooping in and rescuing. This is about us building you know, collateral with environments. For example, in Kenya, basic nurses are not respected, and that very hierarchy causes a brain drain. And even though that is the basic level of care within communities. And so our agenda is to actually, but they have PhD nurses that are engaged in change. And so we're moving towards a cultural way of thinking. And so we are starting with promoting interdisciplinary teams, because that's been a part of what's improved medicine in the United States. And so we're not trying to export just a Western medicine. We're exporting what we see are valuable teams that make a change in access and quality of care, and the One Health concept. The other thing I was going to say is we have to be very sensitive about how our developing nations are recovering from this pandemic. We're going to be vaccinated and ready to go. My contacts in Kenya can hardly even answer because their systems are so broken. So we are going to have very careful strategic plans going forward from here.
So, Pat, did you want to add anything?
Great. But I could, specifically, what would you like me to add? Okay. So what?
I don't have a specific. If there was
Anything.
But this
You don't want me to feel left out. Don't worry, I won't feel left out. But I did want to mention that along this point about that Shakira made and Laura made about you know, this idea of you know, us going in and helping, saving, teaching, training, you know, and is consistent with the kind of colonialized approach to global health. Okay, that we are all hopefully increasing our awareness, along with our awareness of the importance of anti-racism, that's not the way to do global health. You know, it is how we have been. It's how people will be continuing to. That's our funding structure and everything. But we're doing. I'm involved in. It's not no expertise, but I'm throwing this out here because many of you may know more than I do. I'm learning, okay, a lot, because the UC Global Health Institute, we're going to have our UC Global Health Day is going to focus on decolonizing, okay, or decolonializing global health, our approach to that, and anti-racism to increase health equity. So it's a complicated subject, but so I think Shakira and Laura have made some excellent comments, and just in the context of our students specifically. Our students, yeah, we always talk about that, and that's why I love what we're trying to do is help them connect with mentors in other countries that they can learn from. All right, so they go in with this cultural humility that they, you know, they're not there to tell anybody else what to do, but rather to learn, to investigate, and that in doing that, the linkages that we form between our faculty and the faculty in other countries, that sometimes that turns out to be mutually beneficial, is what we found. So, and I think some of you know we have some big research programs like the One Health Workforce Next Generation, and in that too, it's all really about how do we help. How do we learn from other people? All right, in low and middle income countries, and even you have to question that how we refer to that, and what can we, not just what would we give, but what's a mutual benefit and learning, especially. That's why I love this global education for all. It's global learning. Okay, all of us together. And I just also want to, this point that's been made about Zoom, now that we're all getting used to Zoom, guy, what are the opportunities that this can afford? All right, to start bringing more of a global perspective into all aspects of our curriculum. And because we're like Laura, we have a very tight curriculum, okay, based on accreditation. So the dean and I have been brainstorming, how do we frame this so there's a more integrated, instead of, hey, let's do a course on this, how do we just throughout our whole curriculum start sowing the seeds of greater global awareness and global learning? So that's why I love the leadership that Global Affairs is giving us. That's a something. Did I add something?
That's a great something. Thank you so much. I just want to say before we go into the next question, and not speaking as a moderator, but somebody who teaches writing in health, and I'm teaching again in the spring, the same course, you've all inspired me to develop at least 3 new assignments. So thank you for that. I got so excited. I kept notes about what I'm going to do. But we have another question here. And it's from Kristen. Kristen, would you like to ask a question?
Well, I was just curious to what degree other programs are able to sort of include the concept of sustainability and integrating the whole community into their programs. It just seems like that seems to be the trending theme for these programs. And I think that seems like a great opportunity for learning. I'm just curious if there was any follow-up to that other panel members may have.
I just want to say, Kristen, it's people like you, you're the drivers. You're the one that's making sure that we do this. All right. That because that's what we notice with our veterinary students is that the ones that come and say, you know, they're not going out just to work on an animal or a species or something. There's a lot of interest in community engagement and sustainability. Absolutely. And the focus on the UN Sustainable Development Goals and how we in our own, from our different professional perspective can contribute to those. That's another way to engage people in the discussion. So Kristen, keep asking the question because you are the drivers, okay, of this.
And I want to respond that, for example, our student interest group around global health has kind of lapsed. That's the first thing we should get right back going is the student leadership for student interest group, a SIG, around global health, which we've had in the past. So that's a first step that could be very, very good, Kristen. We'll tap you.
Yeah, and also include the College of Ag and Environmental Sciences, because that's the other thing. Our students have linked with like the International Ag Development Group, graduate group, but there's so many more there. That's also a really important part of the One Health thinking is the environment and agriculture and nutrition and all of these, you know, in the nutrition program. And yeah, so Laura, if we're going to do something like that, we should do it.
Yeah.
I think we have a question here. Is it Shola? Is that
Shola?
excellent?
Hello, thank you to all the panelists for the amazing insights that you've shared. I'm curious about the student and faculty exchange opportunities. Currently at UC Davis, I think Dr. Bandolin spoke of that briefly. What programs do we have? What are some of the challenges and strengths that you have, been identified, in any, if at all, exchange programs between faculty and students as well, between UC Davis and international sites? And what are some of the challenges, particularly outside of COVID, which is a kind of global uniform challenge, but other challenges that inhibit such collaborations, if there are any or anticipated?
I'd be happy to start and try to field that. And thanks for that question, Shola. I will say that clearly things have changed a lot. So I can speak a little bit more to pre-pandemic times and then a little bit how we're doing it now. So before the pandemic, one of our big goals was not only for us to go to international sites and learn and get a sense of what the setting is like, what the practice of medicine is like, but I think even more importantly, having our colleagues, especially in places where they're developing their own programs, just come and see what we do too. We've realized that when we can both do that, it's incredibly important because especially in medicine, we so often feel like we're speaking a different language sometimes when we're talking about certain things, especially using medical jargon. And so I think it's always been a really wonderful experience when we can do this intercultural exchange. I think the thing that is always the most challenging on both sides is time, and then also making sure that we develop a really safe, high yield environment for learning. So for example, a lot of times when we're going to countries, and especially practicing in emergency medicine, most emergency medicine settings are pretty chaotic and often can be unsafe, honestly. And so we really prioritize that is how do we make the environment safe? Because more importantly than anything else, I think people only learn when they feel relatively comfortable and have some sort of plan. So we often will be involved with partnerships for years where we're having faculty go back and forth, maybe sending one student at a time or one fellow before we actually introduce it and open it up as an intercultural exchange for this exact reason. I think also having set goals is very useful, but also realizing that you have to be incredibly adaptable, right? I mean, I think I'd say at least half the time we have a project in mind before someone does an exchange, and then that project just completely falls apart as soon as they arrive, and we have to come up with another plan. But I think that's why having this strong relationship and partnership before, where we feel like we can communicate well and it's a safe experience, has been the most useful. I think the biggest challenge that we face with especially trainees who are in medical school, residency, or even faculty, and as I mentioned before, is really just time, because everybody is so busy and these programs are so intensive. I know that my colleagues in the vet school and nursing school and everywhere else also probably feel these same pressures, but people very rarely have, 3 to 4 months in the middle of their training to go. And so resources are always challenging, finding money to travel, but that's something that I think is a little more tangible, a little easier to work on, but time is really that thing that we always want more of. I will say that now in this current remote kind of virtual era, we found some wonderful opportunities where we can do things remotely and actually have been able to get more trainees involved with educating and then collaborating internationally over Zoom. So we've been trying to do a lot more of these cultural exchanges over focused learning points and educational sessions remotely. And that has been a lot of fun. So that's kind of where we're at from this School of Medicine and the Department of Emergency Medicine.
Thank you.
Laura, did you want to speak to this question?
Other than one of the challenges we have is we have difficulty recruiting faculty, but there's a big pay discrepancy between faculty and being a practicing clinician. And so we're hard pressed to cover our positions in the school. And so finding release time is really, really difficult. We cover each other. That being said, we also can't send students without having specific faculty to supervise them, because they can't get clinical credit for being in another country unless faculty is with them. So there are some barriers to some of those exchanges. That being said, we have a PhD student who is actually faculty in Kenya, who I went and actually spent time at her university in Kenya, and met her co-faculty, and we are now building relationships. So she's here, I was there, and we just completed the circle and found out one of my contacts that I'm very close with is actually her uncle by marriage, So the more you get out there, the more you find it's a very, very small world. So we need to do those exchanges. The face-to-face cannot be supplemented, by the Zooms. That being said, we are looking at doing an interprofessional conference with the University of Nairobi School of Medicine and School of Nursing to promote this model from the SPLICE program, which is interprofessional education and student learning. So we are looking at doing that remotely now, that we were going to do on site in Nairobi.
So I want you, it's a really good question. I wanted my colleagues to go first, because I think the School of Medicine, I know, has many more exchanges. We found that we really can't do student exchanges with the School of Veterinary Medicine, because we have so many students that and veterinarians who want to come here, and we don't have the capacity to take any in our classes or clinic, except a very limited program. And then that's not an exchange. Okay, so we've stopped making commitments to exchange, but we like the wording in Global Affairs uses mobility. All right, so there are some ways that we can facilitate mobility for people to come here. It's on my wish list. I wish that we had more funding that we could help people come here. Okay, but and I'll talk about that in a minute on the faculty. But on the students, we don't support exchange programs, but what we do try to do is make these connections between mentors, all right, and for research, because that facilitates mobility, and then programs that provide funding for research, all right. So that's another place, shout out to Global Affairs, that have helped us facilitate some of our partnerships with the University of Sydney, for example, that resulted in funding that allowed for both students and faculty on both sides to move around, getting both sides to commit to Sydney and UC Davis. And that was a campus-wide thing. I mean, that wasn't just the School of Veterinary Medicine. And then the UC College Dublin was another really good example of where we started. We got actually an industry partner, Zoetis, interested in supporting a partnership that started out with just a symposium, okay, and started out, it's just kind of interesting how it started out. Then we found a funder, or they found us, and that's been able to facilitate travel between our two institutions for faculty and for students. So we've had to be more creative. So we don't even use that word exchange, because that's a commitment that'll go both ways. And oftentimes it doesn't. We're going for creative mobility. Okay. And the seed grants is another way that have facilitated that, the Global Affairs seed grants that have allowed people to move. So I think I'm a big supporter of continuing those efforts from our own school, but also at the campus level to make that possible. But keep raising that question, because just like with Kristen, it's that nudge that keeps us, looking for the funding, looking for those opportunities. Does that answer your question?
It does. Thank you very much.
Annalise had a question for Laura, and then maybe we can hear from Professor Worley, who offered to help comment on the student international rotation opportunities. So Annalise, yeah.
Oh, I think the question was pretty self-explanatory. I was just looking for any information you had on opportunities for students at Betty Irene Moore School of Nursing to be involved, and maybe, or just ideas for potential future opportunities.
Perhaps I could just comment on that now. I'm the instructor for the nurse practitioner students for their clinical year experience, and we do have opportunities for international rotations. We had several students who were hoping to go this year, but obviously that was all canceled because of the travel restrictions. So that they are generally arranged through outside agencies that accept students, and so we'll be talking to you guys some more about that. There's information on the Canvas, the main Canvas site under clinical rotations. There's a tab that says international rotations. It's got some of the information. We'll be talking about that more later. And for the students, our students who are on this call, feel free to email me and I can talk about this a little more with you. But we have historically been able to offer that. The majority of them have not been direct UC sponsored activities, but a lot of them, they're very it's a very good organization. The main one we work with, Child and Family Health International, and so those opportunities are there. And we'll be sharing more details when we get into this a little bit later in the quarter.
Thank you so much. Annalise, do you have a follow-up, and then anybody else can chime in?
No, that was very helpful. Thank you.
But then Shola very quickly wrote, are there opportunities for postdoc seed funding for global health projects? Most of the funding is targeted for UCD faculty, so please advise.
Well, can I just say on the postdoc, if you, that's why I wanted to mention that at NIH Fogarty Fellowship, okay, GLOCAL, okay, GLOCAL, I can actually try and put it in there, or go under UCGHI, UC Global Health Institute, and all the information is there. As I said, this year is gone, but it'll come back around next year, probably advertised in October or November, and worth planning for, because it is competitive. But I was just so pleased. We had the largest number of UC Davis applicants, including from the School of Nursing. Okay, medicine we haven't, and that's unfortunate. But we're happy to work with people that are interested, that start early and think about that. Okay, because that's an NIH postdoctoral stipend and research money, and a great opportunity for orientation at the NIH. You meet Tony Fauci in person, if you're in person. And I know it's a highlight. I'm a big fan. And tremendous mentorship. So I know Global Health and Global Affairs and both schools help to promote this, but I still don't think we're getting the word out to get the best applicants. So postdoc fellowships, but also some for medical students and vet students.
Can I make a quick comment about when we align students with certain organizations? I get contacted all the time about individuals who have contacts in a variety of different countries, more the Central American because of the local access, but that they want to start an NGO or they know of an NGO that's there. And there's many of those opportunities, but I really think it's important and on us as faculty to vet the organizations that we are sending our students to make sure we have personal affiliations with them, that they have recognition and safe standards according to US standards. And we have a lot of responsibility there. And so that getting that in place is all really important. And so those long established relationships that Shakira mentioned that Pat has are really important. So other faculty, I strongly recommend you align only with well-organized organizations, well-established, and don't just jump on something because someone approaches you.
I just want to second that, and even seek us out. I mean, in your respective areas to help look into that. We do that as well.
Any other questions? And I'd be very glad to, I just grabbed everything in chat and all of the links, and I'd be glad to email you all with all the links so that they're right there. Nancy raised her hand. Go
nice.
for it.
Okay, thank you so much, everyone. It's so great to get to hear this rundown on your programs. I was curious, you all talked about pivoting to integrate more virtual activity in response to COVID. And I'm curious about whether you see yourselves continuing to use that as a strategy.
I want to make a quick comment. I said sometimes there are things that don't replace experiential, but I think definitely from a resource standpoint, the less we spend on travel for a variety of reasons, if we can transfer knowledge and mutually between countries, there's value in that. But I'll share with you, I'll never forget the time I was traveling with the agronomist with the group that I work with as my translator. And I just read an article on vitamin A deficit in individuals taking HIV meds out of Tanzania. And I said to him, I wish they could eat more carrots. You know, he said, they could grow carrots because they do a garden. They sponsor teaching them how to do a garden. He said, I'll give them seeds next week. I'll start teaching them how to grow carrots next week. And they're required to keep half for their family and sell half, which he said, that's even better because there's a blight on maize right now. And I don't want them growing corn. The serendipity of being in that car with the agronomist after I just read a research article prepping for that trip changed what they were growing in that garden.
Laura, that's wonderful. I'll go ahead and follow up too, because that's such a good example. And so to answer your question, Nancy, absolutely. I mean, I think that we've realized, so in global emergency medicine in particular, especially with clinical work, I've noticed this parallel trend. So even in our emergency medicine education or education around in the School of Medicine in general, locally, we've incorporated more and more technology every year, from simulation trainings to figuring out ways when people are on different rotations or in different places, how can we connect? And then that actually transitioned really easily over to international education. And so there's also been a big push in residency education, especially in emergency medicine, to actually create free online learning for everyone. And this has been going on for years and years and years. And as a society, we've developed more and more of this. And so it almost was one of those things where when the pandemic hit, I think everyone felt like, okay, we didn't realize, but we've been preparing for this for years. And so the transition actually to remote, even though, you know, I don't know a lot of us really missing our colleagues and friends overseas, it's actually been wonderful. And I know Laura mentioned about the resources, but that's something that we struggle with ethically also. You know, it's like, should we be spending all this money going back and forth? Or should we figure out ways to maybe do that for a little while, but is there a better way we could spend the funding to help our partners or to create different programs? And so I think this is just the start of many future conversations about how to integrate this into education, both domestically and abroad, for a long time.
And I just say I couldn't agree more. And where I really had this demonstrated to me is this with the One Health Workforce Next Generation program that Valtrina Smith is leading with Donna Mazzette. And when they had, normally they would have meetings, going out with these universities in countries all over Africa and also in Southeast Asia. There's two big groups, but instead they were doing them on Zoom. And it was amazing how effective and efficient, and it wasn't just them lecturing, it was their partners reporting and interacting and all of that. And so I think they've just really gotten good at that. And I think there's so many more things that we can do. The one other thing I want to make sure everybody knew about, and having Nancy and made me think of it, is the Global Connections Database. Okay, I just have to mention that, all right, that everybody knows, so I don't need to show it. Okay, so that you can get to through Global Affairs. We've made it a major portal on our website as well. We talked about sustainability, we talked about transdisciplinary, we talked about One Health and everything. I think it's a tremendous tool for people to be able to figure out who else in UC Davis, something we've been waiting for a long time, to be able to link more easily. It is interested in a country that we're interested in, and how do we, from all the different colleges and schools. So I'd be remiss if I left here. I know I sound like the promotion team for Global Affairs, but
you're fabulous.
I am. I knew what it was like before you guys came. Maybe that's the advantage of being the person longest on the block. I don't know.
Right. And that link is in the chat right now. Thank you, Pat.
Yeah. And on the front page of Global Affairs, or you can go to our website under faculty and it'll take you to Global Affairs.
But no, we're not paying you to say these things, right? It's not salary. We have about 6 minutes to 3:30. So any other questions?
I had one. So this is going back just a little bit to the partnership element. And Pat, I wanted to know if you can share how the students, I really enjoyed the videos that the students who did the summer international externship that you shared together online.
They've really gotten creative more and more every year, and you can go, everybody check it out. I mean, there's seriously like 1 to 2 minutes, and it's just amazing. Sorry, thanks, Nathan. That's a nice shout out.
Yeah, no, it's okay. Yeah, it's a fabulous format. I mean, because they take their cameras to the lab, and you get to see where they're working. But I was just wondering if you could talk a little bit about how they find these connections. I mean, my guess is it's through the faculty they're working with, but perhaps not. And can you, does this experience just sort of derive from the pre-existing connection, or does it actually help facilitate further relationship? Or have you ever seen students go back in future years to the same location or institution where they were before?
Absolutely, Nathan, in all different ways, all different forms, but it's very organic process. Okay, in that the students come, they talk to Dr. Paulina Crook and myself. What are they interested in? We think, all right, so who, and this is where the database helps too. Okay, who else on our faculty or in the College of Animal Science? I mean, in Animal Sciences, in the College of Ag and Environmental Sciences, or how do we find people that based on what's their passion? What do they think they want to do, or where do they think they want to do? It all starts with that creative thinking, and then we talk about that a little bit more, and it's a little bit what I know and people I know who know things, but also then we go to the database, and then I help them to learn how to write an email that a faculty member would read and respond to, okay, which is a key. All right. We actually have, if you'd like to know more, we have a guide. We have a couple of things. We have a little 2-pager on that the staff likes to send out before the students meet with me, but sometimes they meet with me and then we send it out. Nathan, send me an email and I'll send that to you. Okay.
Okay.
that kind of says, hey, here are some resources here, think a little bit about it. But I encourage them to come, even if they just have a glimmer of an idea, okay? Because that's because I didn't ever think I would do this, okay? I had no idea that I would end up being so global. I was a cowgirl in Colorado, for goodness sakes, you know? And it all started with falling and getting interested in something, and then having people connect me with other people. And then part of your question too was, and then all two things I want to say. So it's incredibly helpful that we have those stories and links on our website, because I encourage the students to go and look at that, and then contact those students as well, get some idea of what they could create. Okay. But usually everyone is different. Some of them build on each other, but they're a lot of them are really different. So that's a really good resource. Getting to know what the faculty are interested in. And what was the other thing? I forgot the other thing anyway, but that's anyway, as soon as you bring it up, I start thinking one of my favorite parts of my job is talking to these students, you know, and some come in and they say, well, what programs do we have? And I said, well, actually, we got to create it. So let's talk about it. You know, what's your interest, kind of thing. Right. It's, you know, it takes time, right. But it's the outcomes have been really excellent. I think shapes lives. That's what we're here for, right?
Laura, yeah.
Quick comment about how to help students network and what I do. If I'm gonna, I'm tied to an international nursing scholarly, organization, Sigma Theta Tau. Those conferences, I look to see what countries people are from. And I go to the talks of those people and introduce myself, get their information, and keep in touch. Students can do that too. I was looking at interprofessional education to get ready for our seminar in Kenya, and there was an African, nations interprofessional education conference last year that I missed. I went back and saw who the speakers were, and looked at how could I reach out to those individuals. We can teach that to our students too. You have an interest, here's the way you find the people that have similar interest, and you just cold write them, and you find out what organizations they're affiliated with. It is not that hard with the internet, but you have to be intentional. And that's the way it works, what I find.
The thing I'd add to that, Laura, is that oftentimes they need the cold writing. I mean, we all know how busy we are and how many emails get written to us that we don't respond to, even with our best intentions, right? All right. So that's why helping to connect them with our faculty or people we know, who then they can say Dr. So-and-so or myself. Okay. And I remember the other part, Nathan, the question you asked is that what I've seen that's amazing is that sometimes the students end up being not just the catalyst, but the connection between faculty that then set up relationships that end up being that are low risk for the faculty, okay, because they're supporting the student and it doesn't necessarily cost them any money. And then they find out that here's somebody that's doing great things, and then the partnerships begin. And some of those have developed because the students made the connection.
Great. It's fabulous.
Yeah, it is. It's fun.
So we actually have hit time, but I think both Aliki and I want to thank our panelists for creating what was an enormously rich discussion. I think it's going to be a while before we all absorb it. I'm also very grateful that they allowed us to record it, because now the next thing I'm going to do is send word out and say, please watch this, because there is a huge amount for people to be able to absorb. And certainly for our spring cohort, for the curriculum enhancement through global learning, this is going to be, I think, one of the first things we have them take a look at, to think about what it is that's possible within the schools and colleges at UC Davis. I think getting everybody to see the real wealth of what it is that's being done and the wealth of possibilities of what can be in terms of global engagement and global engagement in the broadest sense possible is really amazing here. And certainly one of the things that drew me to Davis as well. So thank you very much all three of you for giving us what has been a really fascinating afternoon in terms of what your schools are doing.
Thanks for bringing us together.
Yeah.
So,
Yeah.
Yeah, thank you guys so much. I feel like I always learn so much at these and then have a to-do list of like 20 things of all these people I want to talk to afterwards. So thank you guys so much.
So I think
you,
we'll
thank
take Laura's here is that it's going and listening and making those connections
Yes,
and
yes.
building out from those. I think this is.
We have more workshops that Liz and I are planning, so we'll keep you posted. So we hope you join us for some more.
Wonderful. Thank you guys so much for your time.
Thank you.
very
Thank
much.
you so
All of
much.
you.